first Friday of college, and I have a Humira injection that's due. So this is what it looks like. It comes in this little box. Pop it open. It comes with a few little things, nothing to be concerned about. That, this, and these two things. Alright, so the box, throw away. Most important is the medicine right here. This is the Humira injector. We got two little guides, not really important at all, so throw those off to the side. Again, little thingamabob, don't need that. Alcohol swabs, those are important. And this little card. This is a temperature indicator, so when it turns red or pink in this little circle, you know that the medicine is no good anymore, because it's either, I think it's gone outside of its temperature limit exceeded when red/pink appears. So yeah, if you don't refrigerate it properly, it gets too warm, or maybe if it gets too cold, I'm not sure, then this turns red or pink. This one, the border of it is like kind of pink. So like, I think it's probably still good. So yeah, when it turns all pink or red, then that's when you have an issue. So back to this. Comes in a little sleeve. Let's tear that open and pull out the auto injector. I believe it's standard 40 milligrams, 0.8 milliliters, and you put it under fat, so subcutaneous use only. Yeah, so I'm going to show you how it's done with this and this, alcohol swabs and the auto injector. So I know I've got some beefy quads after the week-long stay in the hospital and the few weeks sitting on a couch, so I lost a bit of muscle mass, but let's pop this pant leg up, prep the site with the alcohol swab. What you have to note is that before you do any of this, you need to make sure this is warm. It's going to be extra painful if you don't warm this up. Imagine just cold liquid under the skin. So it's no fun. So warm this up. 15 minutes out of the fridge should do it on a countertop, or in my case a desk because I'm in school. So take that alcohol swab out. Let's get this here. Fold it in half, make it nice and easy. Find the spot. I'm going to choose right here, a little bit lower than that mole right there. So make some circles, going from the center outward in bigger spirals, so that's about that big area. Let's do it again, just keep it all good. That's a center, same spot, and out and out. Alright, so now that's all prepped. We're going to pop that cap off like I did. So now that's the injector side. That's where the needle's going to come out, and then we've got side number 2 will pop out when we're ready to go. So I'm basically ready to go. It's been about 15 minutes. I went and took a shower after taking this out of the fridge, so it's ready to go. Take the cap off. We're good to go. Danger side, don't touch that until you're against the skin, otherwise you waste your auto injector. Pinch that skin. In the case of the love handle, would be up here, but pinch it. Relax the leg so that you're not going into any fat so you don't go into any muscle rather, and good to go. So 3, 2, 1, and all right. So all I waited for was there to be a little whoosh noise. It's almost inaudible, but as long as you do it right, keep it against your skin, and hear a click, and then whoosh. And it's going into your skin. You're gonna feel a little bit of a thing under your skin that's gonna be uncomfortable but not painful, and then you're good to go. It doesn't leave really a mark or anything. Nothing noteworthy, you know. Looks fine. So once you've used the auto injector, all you gotta do is cap it all up. And here we go. Cap that all up. So you don't hurt yourself with it, and throw it out. Regular trash. Don't worry about the pharmacy, the online pharmacy in my case, tries to sell me like all sorts of add-ons. They try, or not sell me rather, they're incentivized to give me alcohol swabs, sharps container, any of that stuff. You don't need it. You literally just need the box that it comes with and maybe some alcohol swabs in case you run out or lose them. And then this can just go straight in the trash. In my case, it's just going to go in my dorm trash until it gets thrown into the communal dorm trash in the hallway. So yeah, it's basically done. This is 6 tablets of methotrexate, And for scale, I gave you a little quarter to see that. So not too bad to take. And then folic acid is roughly the same, and I take that a few days later just. So a little hack for anybody with Crohn's or anybody who has to take a lot of medications is learning how to take a bunch all at the same time. So 6 pills and pop them all at once. So this is what the card ends up looking like after another 10 or so minutes of sitting out. It slowly is getting more and more red until it's going to bleed across the whole thing, looking like this card here. We got the whole progression going on. A 0, pink, slightly pink, which is how kind of my card looked like before, but then we got the all pink, so kind of in the questionable zone. I'd say we're between these two, but more leaning towards the totally good, nice and white one. So even right now, it's like only 50-50. That's minutes after many minutes after I actually took the medicine, so we're probably good.